Let's start our today's class. Okay, after muscles of tongue, after basically the tongue, anatomy of the tongue, we will move towards anatomy of the palate. Okay, so anatomy of palate. So as all of you know already, palate, as you all know, is a part of oral cavity, which is the roof of the oral cavity. It lies in the roof of the oral cavity, and it has two: anterior hard or bony palate and a posterior soft or muscular palate, which is present posteriorly. So anterior half the palate is hard and it's anteriorly it's known as hard palate, and the posteriorly there's a muscular part of palate. That's soft palate. Here you can see hard and there is soft palate. There is no anatomical distinction between visible distinction between them, but when the bone ends and the muscle starts, comparatively more the soft palate starts. And the one of the important marking of soft palate is uvula. Okay, so first we go for the hard or bony palate. It lies in the roof of the oral cavity. Yes, you already know that. Forms the floor of the nasal cavity. Okay, so it makes the roof of oral cavity, forms the floor of nasal cavity. We are talking about hard palate. Formed by palatine processes of maxilla in front. So maxillary bone has palatine process in the front, palatine process of maxilla on the right and left of the patient. And there is a horizontal plates of the palatine bones behind them. This suture is intermaxillary suture because it is in between, in between the maxilla, two parts of maxilla, which are the palatine process, and these make the hard palate. And there is a fossa inside the fossa, bounded by alveolar arch. So the alveolar arch is formed by the teeth and the socket of the teeth, gums. This forms an arch, right? So this is known as alveolar arch. So alveolar arch, you can say, is the inner boundary of the teeth making an arch along with the gums. Inside to that, it demarcates the anterior or frontal boundary of the oral cavity. Okay. Posteriorly, hard palate continues with the soft palate, not seen here because only the bones are present here. There is also interpalatine suture, which distinguishes or is between the palatine process of maxilla and palatine bone. These bones have a horizontal plate and a pyramidal process. So you need to remember here is, so hard or bony palate is formed by the palatine process of maxilla on the both sides and palatine bone posteriorly. There are two sutures important to remember here: intermaxillary suture and interpalatine suture. Its undersurface covered by mucoperiosteum and shows transverse ridges in the anterior part. It shows transverse ridges. This is one of the ridge, anterior interpalatine suture. Okay, now we go for the soft muscular part. It is attached to the posterior border of the hard palate. Yes. So here is the muscular part of the uvula. If you go to the diagram on the right side, this is the soft palate, and this looks muscular in comparison to this bony structure, bony hard palate. Yes. So this soft palate is attached to the posterior border of the hard palate. Okay, we all agree. The soft palate is a mobile muscular flap. Yes, it is muscular, it's a flap, and it's mobile. It changes with the air, with the food, with voice, speech that hangs that hangs down from the posterior border of the hard palate into the pharyngeal cavity. So this cavity next to oral cavity, there is an isthmus or a pharyngeal isthmus, and that starts a cavity here, which is pharyngeal cavity. So like a curtain or vellum. So the soft palate is a mobile muscular flap that hangs down from the posterior border of the hard palate into the pharyngeal cavity like a curtain. That curtain is known as vellum. And it separates the nasopharynx, we cannot see here, from the oropharynx. Okay, this upper side, they will form a nasopharynx. It connects with the pharynx, and then there is a oropharynx. So this pharynx part is divided into two parts, which the pharynx which connects with the nasal cavity forms nasopharynx, and then which with the oral cavity it will form oropharynx. And there is an isthmus here, oropharyngeal isthmus, covered on its upper and lower surface by mucous membrane. So this soft palate from upper surface and lower surface is covered by mucous membrane. There it was mucoperiosteum because there was ostium, there was bone, so it should be mucoperiosteum. But there is no bone here, so mucous membrane will be enough. That's how you remember. It's composed of muscle fibers and aponeurosis. So we are talking about soft palate. It's composed of muscle fibers and an aponeurosis. What is an aponeurosis? Can anyone?
Flat tendon, sir.
Flat tendon.
Flat tendon. Actually, a conjoined tendon. We should say a band of tendon from different parts of muscles. So a lot of muscles can have their attachment to the tendon, and they will make a tough fibrous tendon, which will be known as aponeurosis. Okay, lymphoid tissue and glands, blood vessels and nerves. So soft palate, we have muscle fibers, aponeurosis, lymphoid tissue, some glands, blood vessels and nerves. Okay, so here is another example of soft palate. Here we can see nasal cavity is zoomed in this diagram. There is soft palate, there are muscles here. It has a uvula. The muscles go from all the way into the uvula. And here, this part is, we have a soft palate. This is uvula. And these are palatoglossal arches, palatine tonsils. Again, a comparison of bony, hard palate and soft muscular palate. So we have a chat here, flat tendon sheet, Irfan. Okay, good job. We have a flat, spelling is wrong. Okay, I think, okay. Anyways, hard and soft palate. Now we go to the aponeurosis. That aponeurosis, the sheet of flat tendon of fibrous sheath. This aponeurosis is basically palatine aponeurosis because it's present at the palate. So it is attached to the posterior border of the hard palate. There is an aponeurosis, palatine aponeurosis, if you can see. Let me just, palatine aponeurosis, oh, sorry. Draw. Palatine aponeurosis is going from here, this one. There are muscle attachment and they are attached to the posterior border of the hard palate. Is expanded tendon of tensor palli palatini. There is a muscle known as tensor palli palatini. This aponeurosis is the expansion of that tendon of this muscle. It splits to enclose musculus uvulae. Musculus uvulae is a muscle. This tendon, this palatine aponeurosis, it splits into half and it encloses that muscle. So palatine aponeurosis encloses a muscle known as musculus uvula. We will later study this muscle. Okay, this guy is gone somewhere. Okay, so gives origin and insertion to palatine muscles. So palatine aponeurosis is an important aponeurosis present at the palate area. It's a fibrous sheet. It attached to the posterior border of the hard palate. It is expanded tendon of tensor palli palatini. This muscle, the tendon gets expanded and forms this palatine aponeurosis. We got the attachment. We know it's fibrous sheath, and it encloses an important muscle that is musculus uvula. and gives origin and insertion to palatine muscles. Why this is formed? Because it needs to give origin and insertion to palatine muscles. How it is formed? By the expansion of the tendon of tensor palatae palatini. This is important. That's why I'm revising. And it has a muscle enclosed musculus uvulae. And what it is? It's a fibrous sheet. Okay, here we again will have a palatine aponeurosis. Okay, and you see a lot of muscles are attached here. Levator velli palatini, and then there is tensor velli palatini. No problem, don't worry about the names, we will remember them. So hard palate posteriorly have a tendon in the middle, palatine aponeurosis. It gives origin and insertion to a lot of palatine muscles like levator and tensor, and then there is musculus uvulae. This aponeurosis is split and encloses this muscle. And then there is cut soft palate. This is not the whole soft palate, this is a cut section. And then there is oropharynx isthmus at the bony structure. So now we go for the muscles of palate one by one. Let's just first read their names. Okay, so one is tensor velli palatini, and second one is levator velli palatini. Okay, so thanks to them, they have the same surname and middle name, but they have a given name different, right? So tensor has a given name tensor because it tenses the soft palate. Okay, thank you. So the name suggests it tenses the soft palate. And then levator elevates, raises the soft palate. So that's why it's known as levator. Okay, so their name makes sense, right? So it's easy to remember now. And their surname and middle name is same, so thank you. And they are attached to palatine aponeurosis. So insertion is from palatine aponeurosis. So these two muscles, tensor velli palatini, levator velli palatini, their name says that they tense and raise the soft palate. Okay, we got it. And then we knew that insertion, there's a palatine aponeurosis, gives lot of give origin insertion to a lot of muscles, palatine muscles. So here we see there's an insertion of these two velli palatini muscles into the palatine aponeurosis. So now we also remember this. Okay, so tensor originates from the spine of sphenoid, and this levator from the palatine aponeurosis and auditory tube. Okay, one thing common in them is auditory tube. So one of the origin of these tensor and levator velli palatini muscle is auditory tube. Okay, so even if you say this name, it will be considered. So tensor velli palatini origin is from spine of sphenoid and auditory tube, and insertion from the forms palatine aponeurosis. This, as we remember, that tensor velli palatini is the muscle whose tendon expands to form this palatine aponeurosis. This muscle's tendon is basically expanding to form this aponeurosis, and it also inserted into this. So it's easy. And then its action is to tensor tenses the soft palate, velli palatini. Palatini is palate, okay? And then levator velli palatini has origin from the petrous part of temporal bone, auditory tube, again same, and then palatine aponeurosis, it has the origin. So levator velli palatini is a unique muscle. This muscle, whereas is forming the palatine aponeurosis from its expansion of the tendon, this muscle gets origin and insertion both from palatine aponeurosis. So it gets origin from palatine aponeurosis and inserted into palatine aponeurosis. And then, as the name suggests, levator elevates or raises the soft palate. I hope by now you have remembered some of the origin, insertion, and action. So it's actually not difficult if we revise them and make a memory or story or visual memory of these muscles. Okay, then the remaining three muscles: musculus uvulae, platoglossus. I think we have heard this, right? I'm sure you have heard that. Oh, platoglossus, and then there was styloglossus, hyoglossus, genioglossus. Aren't we talking about extrinsic muscles of the tongue? And there was this exception with an innervation not from hypoglossal nerve, but from the vagus nerve. Oh, that platyglossus. Okay, we know you. We know this guy. So musculus uvulae, platoglossus, and platopharyngeus. Okay, pharyngeus, pharynx. Okay, plateaus elevates wall of pharynx. Okay, easy. So musculus uvulae, as we know, we have seen the muscle that the aponeurosis, palatine aponeurosis splits and encloses this muscle. And because there is musculus, so posterior border of hard palate, it starts from the posterior border of hard palate, and it basically is in the soft palate, because the soft palate is muscular. And which muscle is present in the soft palate? Musculus uvulae, right? And then the insertion is in mucosa of the uvula. It goes, as we know that it goes all the way. So there are two muscles here. So from the hard palate, it goes all the way into the uvula. So one of them is musculus uvulae. Okay, now we remember that. And it also, it elevates uvula. So what does it do? It elevates. Everything is now tensing, raising, elevating, pulling. So it makes sense. Let's just mark on it, give it some of the more time and importance. Okay, so everything is tensing because it was tensor, and it's elevating because it's elevator, raising. And then this name is not helping, but we know everything is elevating and pulling and tensing, so it must elevate. Do not do anything else. Thank you. Thanks for doing the same action. But because your name does not help us, but your name helps us that it is the main muscle of uvula. Thanks to that too. Okay, then there is platoglossus. Origin is from palatine aponeurosis. There was another person, another muscle coming from this palatine, having an origin as same as this guy was this. But levator was special because it was taking origin from palatine aponeurosis and also the insertion into the palatine aponeurosis. And this guy forms the palatine aponeurosis. Okay. And insertion side of the tongue. There was another which was in the side of the tongue. Okay. And action, because everyone is elevating, tensing, raising, pulling. So it pulls the root of the tongue upwards, narrowing oropharyngeal isthmus. So basically, when it pulls the root of the tongue upward, right? Can we? Okay. When it will move the tongue upward, where can we see it clearly? Okay, so yes, when it moves the tongue upwards, the root of the tongue upwards, so it will close or narrow the oropharyngeal isthmus. This opening will be narrowed when this tongue will be moved upward. Okay, it's fun. So this root of the tongue and base of the tongue, root of the tongue, and this pull upward, this oropharyngeal isthmus will be narrowed down. Really? So this area will be less open? Oh, okay. Now we know. Thank you. Platoglossus, thank you for narrowing our oropharyngeal isthmus, almost closing it. Okay, pulls root of the tongue upward, narrowing oropharyngeal isthmus. So who is remaining? Platopharyngeus. Why plateau? Plateau helps, it takes origin from palatine aponeurosis. It also had plateau. Oh, we also find another relation. So plateau and plateau, when it comes plateau, so origin came from palatine aponeurosis and palatine aponeurosis. Other than that, we saw this guy was taking origin from palatine aponeurosis. But these two, Villi Palatini, Villi to Palatini, middle name and surname same, were actually taking insertion into palatine aponeurosis, and so much so that this guy was making it forms the palatine aponeurosis. Okay, we are trying to make interrelationship. Okay, plateau, origin, palatine aponeurosis. Okay, that's why I wrote it on the right side. Okay, because the origin was same almost. And insertion side of tongue and posterior border of thyroid cartilage, because it's pharyngeus. Come on, you need to go out of the palate, pharyngeus, going towards the thyroid cartilage. Okay, and if it pulls the tongue upward and narrows the oropharyngeal isthmus, this guy elevates the wall of pharynx because it has the name pharyngeus. Okay, easy to remember. So everyone is pulling, elevating, going for the palate and the muscle of soft palate, but this guy has pharyngeal involvement. Okay, but why you are here? Because you are palato, you are origin from palatine aponeurosis. Okay, makes sense, makes sense. I hope now we have remembered some of these muscles. So again, tensor veli palatini, levator veli palatini, musculus uvulae, platoglossus, we love you, and platopharyngeus. We also love you. You don't belong here, but still we love you. Okay, so here we have tensor veli palatini and levator veli palatini. As you remember, they were taking insertion into here. So much so that this guy, which one? Levator or tensor? I think levator looks closer to palatine aponeurosis. So it should be the levator coming and taking in origin and insertion from both here, right? Okay, let's check. Yeah, levator is taking origin from palatine and insertion for palatine. So what is your tension? Why are you tense? You tense soft palate, I understand. So you are tense because you also form palatine aponeurosis. Okay, we give you this much credit. So tensor will also form the tendon will split. Okay, the tendon looks big. Yeah, the tendon will split and make an aponeurosis, the upper portion, lower portion. Good. Okay, makes sense. And then so tensor veli palatini, levator veli palatini. Here is the palatine aponeurosis. Now we know the relationship of palatine aponeurosis and tensor veli palatini, levator veli palatini. Okay, so next is musculus uvulae and platopharyngeus. Okay, why not that platoglossus thing? Okay, maybe we already know a lot of this. So, okay, let's cover these two first: musculus uvulae and platopharyngeus. No problem, no problem. So where are you? Musculus uvulae. You should be here. Yes, uvular muscle. This muscle. How it is enclosed? It is enclosed by the palatine aponeurosis, where it's not shown here, right? And lateral to that is platopharyngeus. Oh, now I understand why are you together, because the median margin here is making the musculus uvular muscle. You are enclosed by the palatine aponeurosis, and from the lateral side platopharyngeus is coming out. Oh, that's why you're together. Okay, now we remember you. You'll not forget. Okay, but do we have a platoglossus here? No, no problem. We will have a platoglossus here. So it is plato and glossus. So plato means palatine. It has a relationship with palatine. Okay. And glossus means tongue. It should have a relationship with tongue. Okay, we agree. So platoglossus muscle. Let's mark platoglossus muscle has a relationship with palate and root of tongue. Okay. And what do you do? You elevate the tongue, so you narrow down and almost close the oropharyngeal isthmus. Okay, thank you. We agree you do. Okay, so muscles of palate again is another representation. So there is platoglossus muscle elevating the tongue, and tensor veli palatini muscle here, and this is a median section. Nerve supply. Okay, let's now come for the nerve supply of palate. It should be easy. Come on, it should be easy. So they say mostly by the maxillary nerve through its branches. Okay, palate, maxilla. Why? It's in the roof. Oh, so upper jaw is known as maxilla. So it should be maxillary nerve. Okay, this much we understand. So what should be the branches named? There should be palatine because it's palate, right? And then there should be a greater palate because it covers a great area of the palate. And there is a lesser palate because it covers lesser than greater palatine nerve. Okay, so there is greater palatine nerve, there is lesser palatine nerve, and then there is nasopalatine towards the nose because here is the nose, right? Okay, easy to remember. So mostly by the maxillary nerve through its branches, greater palatine nerve, lesser palatine nerve, nasopalatine nerve. Okay. And then there is glossopharyngeal nerve, also supplied to the soft palate, region of the soft palate. Okay, we remember, no problem. Okay, here is another explanation, representation. So from the nose side, nasopalatine, we know you are here. And then we remember this fossa, incisive fossa. And then the greater, oh, no ma kwai ma, higher shubanyo. How to close you? Oh, this guy. Now, thank you. Okay, so let's revise again. So towards the nose, there is nasopalatine nerve. We agree, palatine, thank you. And then palatine, greater area, greater palatine, and lesser area, lesser palatine, and it goes towards the uvula. There should be another nerve, which is, come on, glossopharyngeal nerve, also supplies to soft palate. Okay, so now we remember these nerves. Okay, let's quickly revise what we have read up to here. So palate, there was two parts. It's in the roof of the oral cavity. There is hard palate and soft palate, and then it forms a floor. There's boundary, and then soft palate is known as soft because it has muscular, it has muscle fibers at aponeurosis. Now we know this aponeurosis is known as palatine aponeurosis. Is made by the tensor villi palatini and encloses another muscle, musculus uvulae, and gives an origin insertion to palatine muscles. Now we know, we know the 5 names. I like platoglossus because it is repeating. Thanks for repeating. And then they are elevating and tensing, raising. Yeah, except this guy is going to fringes. This guy is beyond his limits, right? And then there is this relationship. Okay, thank you for netter and platoglossus. Okay, muscles of palate. So nerve supply, we have seen the greater area is greater palatine, lesser area is lesser palatine, and then towards the nose is nasopalatine. Other than that, soft palate, glossopharyngeal. Okay, we'll not forget you. No problem. And then this another representation of sensory nerve supply of palate. Now let's just go for the motor. So motor, all the muscles except tensor villi palatini, so you are the exception, are supplied by the pharyngeal plexus. Okay, let's go for you. Can we try? Okay, this is fun. So all the muscles except tensor villi palatini are supplied by pharyngeal plexus. All the extrinsic muscles of the tongue are supplied by hypoglossal nerve except platoglossus, and you are also giving us more tension. You're spreading tension, stress, and you are not supplied by pharyngeal plexus. So you are supplied by what? Trigeminal nerve. Okay, mandibular region. Okay, we agree. So no problem, we remember you. So you are the tension, you are the stress, but we know that T and T. Okay, we got another how to escape this, how to escape this and show. Okay, now we know there is tensor T, and trigeminal also has T. Let's raise this. Okay, that's how we remember. So tensor villi palatini was an exception because it was from the trigeminal nerve. Okay, come on, don't make noise. So okay, this is a good idea to remember. So all the muscle except tensor villi palatini are supplied by the pharyngeal plexus. And so who are you supplied by? By the mandibular division of the trigeminal nerve. Okay, so this is pharyngeal plexus. Before going out in the ending this first class, can anyone let me know the other name of pharyngeal plexus? Anyone? The other name of this plexus is neural plexus. Easy. Okay, no problem. Okay, so this is muscular. Now quick attendance again. So Adnan Safdar, roll
Yes,
number
sir.
0. Okay, you are here. So can you let us know about platoglossus muscle? Anything?
Yes, sir. Palatoglossus muscle origin from aponeurosis, palatine aponeurosis. and it elevates the tongue.
Perfect. What others are taking origin from the plateau
Yes,
gloss? Anyone else? Okay, you
Le-
continue.
Levator velli palatini also taking origin from palatine aponeurosis, and palatopharyngeal is also taking origin from palatine aponeurosis.
If I say that this is different than this in a way that
Yes,
it is glossus from the tongue, it's going to pharynges, is it okay? And
yes,
how
sir.
this is different? Levator velli palatini, how is unique?
Sir, levator velli palatini also taking origin and insertion from palatine aponeurosis.
Wow, you are smart, I'm telling you. Thank you for your answer.